Hello everyone, my name is Kendra Mickens and I'm actually going to be doing a PowerPoint presentation for you all today on Virginia Henderson's need theory. I'm just going to enlarge the PowerPoint presentation for you all. And the next slide you see is the abstract, which is discussing what we're going to be discussing today in the PowerPoint, which is going to cover Virginia Henderson and her need theory. In review, as you can see, we're going to discuss her work as a nurse as well as an educator. And we're also going to look at that because those are the two main things that molded her development of her nursing theory. When we look at the contributions of her theory, we're going to look at how her theory has contributed not only to research, but nursing practice as well as education. Just a little bit of information on Virginia Henderson. When you look at her, she was born in November of 1897 in Kansas City, Missouri. However, she was actually raised in Virginia. And in reading, I found that was due to her father actually being a lawyer, actually working with the Native Americans, and he needed to be closer to Washington, D.C. So that is the reason for the family moving to Virginia. She started her nursing education at Walter Reed Hospital in Washington, D.C., and she attended the Army School of Nursing. When discussing why she actually went into nursing, she became a nurse out of a desire to help. She looked and saw that even in the civil hospitals at that time, they, by her own words, quote unquote, was suffering terribly. And she felt that a way she could help was by becoming a nurse. And when an opening in the Army school became available, she did move into that role. As she got her education in 1921, she then started her career at the Henry Street Visiting Nurse Service after obtaining her diploma. And then she actually started moving into the educator role, with her first position being at the Norfolk Protestant Hospital. From there, she actually moved on after realizing that she felt she needed more education, and in 1932 obtained her BSN from Teachers College at Columbia, and actually followed that up with her master's degree. Then in 1948, she started a 14-year career as an educator at Columbia University. And then in 1953, actually became a research associate at Yale University School of Nursing. And then Miss Henderson actually died March 19th, 1996. But during that time, when you look at her bio, she has an extensive history as a nurse, as an educator. She visited nursing schools throughout until she became in her 90s. She continued to visit schools. She participated in international teaching and speaking engagements. And then in 1979, Connecticut Nurses Association actually established a Virginia Henderson Award. When we look at the highlights in her career, she helped create nursing curriculum for the National League of Nursing. She also revised the 4th edition and then wrote the 5th edition of Harmer's Textbook of Nursing. She also directed the Nursing Studies Index Project, which was actually noted as being the first annotated index of nursing research. And then, of course, as Dr. Colvin has also pointed out, as well as our book, that Sigma Theta Tau International Library is actually named after her. When we start looking at the development of her theory, when Virginia Henderson actually came into nursing, at that time it was thought to be more of an empirics education, which was focused on the needs of the patient. However, not just with her education, but also as she gained more experience as a nurse, it is said that her theory then evolved with her nursing experience. And she actually started to look at shifts in what we were going to focus on. So when we look at her theory, it actually came from both her nursing practice, as stated, and her education. And it is identified that her definition of nursing, she noted as it being her concept. When we look at it, it's the inductive development because of the way she pulled from both her education and her experience to create her theory. And of course, her education first began at the Army School of Nursing. She used both physiologic principles that she actually gained when she was doing her graduate program. And then Henderson's time as a visiting nurse in New York City helped shape her understanding, promotion of the patient's independence, which would assist them as they continue to progress after their hospitalization. Henderson also credited Thorndike with influencing her views based on fundamental needs of man. And her theory actually defines the role of the nurse as it relates to the patient who is ill, lacks strength, or the knowledge to take care of themselves. And when you look at her different theories, she actually doesn't just focus on the role of the nurse when the patient is sick. She actually does discuss the need to also promote health and staying healthy and not just dealing with when they are sick. And the main focus of her theory were the 14 activities created to assist the patient with moving towards independence. When we look at the different assumptions from Henderson's theory, she assumed that nurses care for a patient until the patient can care for themselves, also that patients desire to return to health, that nurses are willing to serve and devote themselves to patients, and that nurses should be educated at the university level. Next, we're going to look at these 14 activities for client assistance. Again, with Ms. Henderson, it was with the focus of the moving toward independence. So we look at things that actually go from things like Maslow's hierarchy of needs, where we look at breathing and breathing normally, the ability to eat and drink adequately. She also discusses the ability to eliminate waste and also movement, the need for proper sleep and rest, also just thermal regulation and maintaining a body temperature. She also goes into just good hygiene with keeping the body clean, avoiding dangers, again, going into a little bit of that health promotion, and then communicate others in the expression of emotions and needs, worship according to one's faith, also work in such a way that there's a sense of accomplishment, participating in various forms of recreation. So again, a simple thing of work-life balance, which I know we still work on today in 2015 of trying to accomplish. And then she also looked at use of available health facilities, all those in her 14 activities, as we as the nurses helping this patient try and get back to a place of independence. When we look at her impact on research, she worked to actually change the focus of nursing research from what it was prior to her becoming involved, where we're now actually looking at not just the educational part and studying the research of nursing education, but actually looking at the impact of our practice and outcomes. And again, when we look at those 14 activities, it has been noted that they can individually be used as a basis of research themselves. And then theory served as a framework to help confirm values of tested interventions. And then also there was a care dependency scale that was created by an international team based just on Henderson's concepts of nursing. When we look at her impact on nursing practice, again, those 14 activities are used to evaluate nursing care. They actually promote nurses furthering their education, promotes care of the patient by the nurse until the point that the patient, again, can resume care themselves. It also looks at the nurse recognizing their role in educating the patient, again, even when they're healthy, or just letting them know, again, the things that they will need to know once they're no longer in the hospital. And then with that care dependency scale that was developed, it is actually in clinical practice being used as a fall risk screening. When we look at her impact on education, as her time as a nurse and an educator, she wrote numerous volumes and had numerous contributions to textbooks. Her concepts have been used in nursing education, and she's noted as contributing to literature for over 60 years. When we look at her promotion, again, the impact that she had for nurses receiving a university level education definitely promoted the fact and put the focus back on not just stopping at a diploma level, going on, and she actually was an example herself of moving on and getting her bachelor's and then her master's degree. In looking at how her theory could be used for promotion and evaluation, I actually took those 14 activities and divided them into those two groups. And in reviewing her 14 activities, you could almost see how they are geared to either promotion and maintenance of one's health, and actually then evaluating whether that has been met. So for eating and drinking adequately, again, a promotion of just proper sleep and rest, selecting suitable clothes, promotion of proper communication, participating in one's faith, all of those struck me as promotions, things that we could actually have the patient do if they were ill to hopefully help them get better faster, but also again intending to the person who is maybe not ill yet but could benefit from eating properly, drinking adequately before they actually have health risks. And then taking her other points of evaluation of looking at seeing, is this patient breathing normally? Are they able to eliminate body waste? When we look at their body positions and postures, are they moving and maintaining desirable postures? An evaluation again of possibly preventable problems such as decubitus ulcers. And then also looking to maintain and evaluate, are they able to maintain their body temperature within normal range? And then adjusting clothing and modifying the environment. So that was just how I looked at those 14 activities. And again, ongoing, and I can see how it could be used again for research. Absolutely all of them. Just in this example of being used in actual practice for a nurse and how she would take care of her patient, or for a patient coming into the office, how you could actually switch that visit into looking at more of the health promotion, as well as ways to get maybe a new nurse to start thinking about how to address a patient in just the two areas of health promotion and then prevention. Also, evaluation of any health issues that they have. And then although it was too long for me to actually play for you all, I have now provided you with two different sites that have an interview of Virginia Henderson from 1978. One is from the National Institute of Health, and the other one's actually for the Sigma Theta Tau website. But either one, if you have the time, please feel free to click on either one to watch that interview, very insightful interview from Ms. Henderson. That ends my PowerPoint presentation, and here you can see my resources. I hope you enjoyed it. Thank you.